Well, for us, as a traditional player in the healthcare industry, this is a great way to connect to new ideas, to potential partners, to new technologies, and see what's out there, so that we can really have a better understanding on how the world is changing beyond our traditional sector, and how can we integrate all those changes and all that innovation for improvement of health and for the patients that we care about, which is the diabetic patient. The main takeaway is actually that so many new players are moving into the health arena. A couple of years ago, the traditional industries, the pharma and the diagnostics and the medical device industries were the big players in this market, and now we're seeing that telecom operators, software companies, startups, a whole bunch of new and different companies from different sectors are actually moving into the healthcare environment, which is really exciting, and I think will really bring some new value to the solutions that we will be able to provide. And what we're doing, and you're seeing that with the creation of a startup, basically like Eminence within our group, we're looking at exploring potential new business models and potential new value propositions for the healthcare sector, specifically for the treatment of diabetes, which go beyond the traditional models that we have with the medical devices today. So we're trying to connect the different dots. We're trying to connect the pharma industries, we're trying to connect the technology, medical devices and diagnostics industries together in a digital way in order to provide better outcomes at lower costs. Well, the challenges of the implementation of connected health, on the one hand, is a business model challenge. The way healthcare systems are set up today, many times quite fragmented between primary and secondary care, also fragmented in terms of how budgets within healthcare systems are done, really do require some fundamental changing of the setup. If we look at the entire cycle of treatment of a specific disease and not fragmented per sectors, I do believe that digital health can really make a difference by integrating all those different approaches that they are in a more comprehensive way. So what we do is integrating the different aspects of this fragmented healthcare system in a new way, very much based on the data that is already being generated by the products that are available today. So the question specifically again for diabetes care is, with all the data that's being generated every day, and only here in Barcelona we talk about 400,000 data points that people with diabetes are generating. What else can we do with the data in order to improve clinical decision making for the individual, but also improvements in workflows and clinical pathways for healthcare systems? And how can we use that data in order to empower patients to take a more active role in the treatment of their disease? Well, quite clearly the integration, what we call digital health, will shape this future. And within that, what everybody's talking about is big data. Now, there are very few people who actually know what big data is, but we all have a vision around that, which is using data for improving care and for improving therapeutic decision making.